Whatever video Danny Bossa did on subcutaneous TRT injections and Gil T did on the intramuscular DELT injection and recently on the ventrogluteal intramuscular injection, people are always commenting, well, you didn't aspirate. So what about aspiration, Gil?
This is the TRT and Hormone Optimization YouTube channel. And if you want to learn all about the science-based information on this topic, consider subscribing, hit that notification bell, and you'll be on your way.
Well, all I do is I just put the needle up against my skin, okay, and just push it through. Now, that time there, I literally felt nothing. There was no discomfort whatsoever of any kind. So I'm going to keep this guy stabilized with one hand, and then using my other hand, I will push on the plunger, okay? So I'm going to hold the base so my needle isn't moving around too much, and use my other hand to inject.
Done.
Easy as can be.
What about aspiration, Gil?
Aspiration, for those that don't understand what aspiration means when it comes to injections, to aspirate simply means to breathe. What aspiration means in terms of injections is it means to draw back on the syringe, on the plunger, in order to draw air or blood into the syringe. By doing this, you're essentially ensuring that your needle tip is not in a blood vessel. And the goal of aspiration and of an injection is essentially to determine, are you in a muscle or are you in a vessel? Now, here's why this is not important when injecting testosterone. First and foremost, the difference between a subcutaneous and an intramuscular injection physiologically is one is in the subcutaneous tissue, which is adipose or fat cells. The other one is in muscle. There are a couple of ways to determine which one it's going to be. First is needle length, and the second one, which is what's taught in most medical programs, is going to be the needle angle. The needle angle is going to be determined at 90 degrees for an intramuscular and a 45 degree for a subcutaneous. And then when you get into your field, I believe, is it a 5 or a 15 degree for a dermal?
15.
15 degree for dermal. Okay, so by changing the angle, you're changing the depth or shallowness of the needle. So for intramuscular purposes, we're going 90 degrees. You have to understand that the blood vessels, the primarily veins, arteries, etc., we're not concerned with capillaries here. The blood vessels that are essentially delivering, and the veins, just for anyone who doesn't know, arteries lead oxygenated blood away from the heart. Veins lead deoxygenated blood back to the heart and to the lungs. So the goal of aspiration is essentially to prevent an air bubble from entering, or in this case, you know, they refer to the oil embolism that occurs from the oil-based carriers, from entering the heart and the lungs, which is then going to cause a discomfortable type of a cough. Here's a couple of issues. When you're putting in an IV, that needle is intravenous and it stays there and it delivers either via gravity or a pump, it delivers a slow infusion over a period of time. So to make sure there are no air bubbles in that line is very essential, because you know you're going to introduce air into the vascular system. When you're doing an injection, the volume is so small and the angle is at 90 degrees. So you're not going into the vein directly. You may nick a vein, you may go through a vein. The chances of actually landing and ending up in a vein is so small, not to mention IV needles are put in and secured prior to the line being introduced. With an injection, you're putting this in, you're holding the plunger, you're pressing the plunger, that needle is going to move. Even if you're in a vein and you aspirate, the mere act of aspiration is going to pull that needle tip out of the vein.
Before we continue, if you appreciate the content we bring to this channel, check out the Amazon links in the description of this video. These are the links to the products we use, going from supplements, protein powder, pre, post, intra-workout, anti-aging cream, sunscreen, needles and syringes to inject, and so on. If you'd like to purchase one of those products, please use the direct link so that it will earn us a few cents as a tip, and you'll be guided directly to the products we recommend. Thanks in advance.
All links should work on the US, Canadian and UK Amazon stores.
So you're not going to end up in a vein. And if you were not in a vein when you aspirated, as you apply the pressure, you may enter the vein. Either way you look at it, at 90 degrees, you're not introducing this into the vein. You may get a little bit. It doesn't matter. Nothing will happen. The worst thing is you'll get a little bit of tightening in the chest, maybe a cough or two, and you're done. You're not going to kill yourself. And again, you're not injecting 3 cc's of air. If you got a couple little air bubbles, chances are that's going to be the backspace that ends up in the needle, and it's only going to help you push the rest of the medication through. Aspiration is a complete waste of time when it comes to intramuscular injections. It used to be taught way in the day in nursing school. It's still taught in some programs. It's not taught in others. I know it's controversial. Bottom line is I've done thousands of injections on myself. We've done injections on thousands of patients. We do not aspirate intramuscular injections. There's no need. And if you consider that most TRT guys, at least by the way that we like to administer, you're using an insulin syringe, and you are essentially using such a small volume because you should be injecting at least twice a week. So even if you're on the top end of, let's say, 200 milligrams a week, you're using half an ml of oil. You're not going to do any damage here. These are micro doses. So don't worry about it so much. Just take your injection and be done. All you're going to be doing when you're aspirating is moving that needle in and out. And then when you pull it out and you say, oh, it's bleeding. Well, you just basically put it in there and kind of like shimmied it around, and you're just creating more tissue damage. Get it in there, secure it, push the plunger nice and slow. Rule of thumb, give it about 10 seconds per cc. So if you're doing an ml or if you're doing half an ml, give it about 5 seconds. Don't try to like jam it in there with a pressure washer effect. Give it a nice and steady pressure, slowly let it drip in, pull it out, swab it, massage it, you're done. You don't need to start moving the needle, pulling the plunger in and out. It is completely pointless. Do you have anything to add to that, Steve? I know you're a physician. You do a ton of injections in your practice.
I completely agree. I was taught to aspirate as well, especially for the intramuscular, and I always wondered why, because as you clearly explained, by the act itself of aspirating, you're moving the needle around. So I always wondered, and yeah, now you've proved me right, but I didn't do it anyways. So there's no point in that. Okay. So as mentioned for the viewers, Gil did an excellent video, a very popular one on intramuscular delt injections, where he explains the angles with all nice pictures, PowerPoint presentation, and so on. Go and check that out. I will link it in the description of this video. Thanks, Gil.
Pleasure. Thank you.
And now do this next. Click on one of these thumbnails to learn a ton more about TRT and hormone optimization.